today we're going to be discussing Ozempic. I have two special guests with me today, and we're discussing their experiences with Ozempic. I'm going to go ahead and start. The first person is Linda Preseley. If you can go ahead and introduce yourself, Linda.
Hi, my name is Linda Preseley. I'm 51 years old, mother of 3 adults, 1 grandbaby. I am type 2 diabetic, and I am on Ozempic.
Thank you. And I also have Belinda Williams here. Belinda, if you could go ahead and introduce yourself.
Hi, I'm Belinda Williams. I'm 53 years old. I'm a type 2 diabetic, and I'm on Ozempic.
Thank you, ladies. Now, what type of diabetes do you have and how long have you had it?
I'm a type 2 diabetic. I've had diabetes for probably about 10 to 12 years now. Okay. Somewhere in there. Yeah.
Okay. And Belinda, how long have you had diabetes?
I was diagnosed with type 2 diabetes in 1998.
What type of medications have you taken with your diabetes?
When I first got diagnosed with diabetes, my doctor put me on metformin, 500 milligrams once a day. That's pretty much been the same for the last 10 years. I've been taking that, and then I asked her in February about doing something different, because she did say the last time we did blood work, my A1C had creeped up a little bit. She was like, well, maybe we'll go ahead and add a second pill and go to 1,000 milligrams of metformin a day. And I was like, oh, I take enough pills. So I was like, well, what about Ozempic or one of those ones I see on TV? Can we try that? And she's like, yeah. Instead of adding a second pill, let's try Ozempic and see how that works for you.
Great. And Belinda, yourself?
I've had an extensive journey with medications when it comes to being a type 2 diabetic. In 1998, I was diagnosed with type 2 diabetes, and they put me on a medication called glucophage, which is actually the same as metformin. At the time, that made women fertile. So closely around that time is when I got pregnant with my first child. And when I found out I was pregnant, the doctor put me on injectable insulin. So I had to take Novolog during my pregnancy. And that was the injectable insulin. I had to inject it into my stomach every day. And after I had the baby, I was able to start back on the glucophage. But at that time, I believe they changed the title or the prescription to metformin. And I've been on many medications since. I went one time for, it was a research deal where you got paid to take a medication for your diabetes. And the first medication for the research was Actos. And they found that Actos caused mice to have tumors on their bladder. So when I came up with a urine test that was irregular, they discontinued me from the study. And so I didn't have a tumor, but I did have a regular urine test. And they didn't say what that was from, but I'm pretty glad that I didn't remain on that. Afterwards, I've taken Siliqua, glimepiride, and recently I got put on glipizide due to some complications with me not being able to get approval for a higher dosage of Ozempic. So right now I'm on metformin, 1,000 milligrams a day, twice a day, and I'm on glipizide and I'm on Ozempic.
Okay. So how long have you been on Ozempic, Belinda?
I've been on Ozempic for almost a year. It's been about 8 months, I want to say. And I started off at the lowest dosage. I believe it was 0.25. And then last year in around, I want to say April, I got my dosage moved up to 0.5. And then October, they wanted to move it up to 1.0. The problem is that since October, I have not gotten approval for the 1.0. So since my blood sugars still were not stable like they should be, they would go down and they would go up. And that was the same case with my father, because he had type 2 diabetes and my mother has type 2 diabetes. So my father had the very static blood sugars. And so I have that as well. So what they did, they put me on glipizide. So I started glipizide about 2 weeks ago. So I'm on 3 diabetes medications at this point.
Okay. Linda, how long have you been on Ozempic?
I've been on Ozempic since March.
Of this year, 2022?
Yes, March 22. Yeah.
Okay, great. Awesome. What dosages are you currently at, Linda?
I just moved to the 1.0. I started out in March with the 0.25. I was on that for 3 months, and then my doctor moved me up to the 0.50, and I was on that. And then I recently, I guess this will be my 3rd week on the 1.0.
Okay, great. And Belinda?
Started out at 0.25 dosage, and then a couple of months later, I got more blood work done, and they moved me to the 0.50. I'm still currently on 0.50 because, like I said before, the insurance has not approved the 1.0. However, I recently changed doctors and got a paper prescription that I took to a pharmacy, and they have a very good track record of getting those medications approved. And I might have to use a card that I got offline by applying at the makers of Ozempic, the website, and a discount card. So I may be able to use that if my insurance doesn't approve. So I anticipate getting the 1.0 dosage within this month.
Okay, great. So also, ladies, you both are been on it for a little while, and so how much weight have you lost since you've been using Ozempic? Belinda?
Okay, since I've been using Ozempic, it's been maybe 15 pounds altogether. So I've had some struggles with my weight going up and down because of different eating habits, because of the consistency or lack of aerobic type exercise and fitness. So those things are being put back in place so that I can have a more consistent, continuous progress on this medication.
Okay, and Linda, how much weight have you lost?
I've actually lost 40 pounds since March, since I've been taking Ozempic.
Awesome.
Yeah, I haven't worked out. Maybe if I work out, it could be even more, but that's just been, the medicine has made it where it's difficult for me to eat. I'm lucky to consume a meal. I'm lucky to eat once a day. And then of course, the side effect of having to go to the bathroom as well. So I'm not complaining about it because I enjoy the weight loss. So yeah,
Exactly.
I've lost 40 pounds since March.
And so, Linda, what are the side effects you've had since you've been taking Ozempic?
Pretty much since I've been taking it. In the beginning, it was just like stomach cramping and diarrhea. The little soreness every blue moon at the injection site, which is, hasn't really been a factor. But the main thing has been the diarrhea. So sometimes when I eat, it's like right away I gotta go. I could be at a restaurant eating and I'm like, okay, like I need to go.
Yeah.
It's gotten a little bit better after I've been on it for a while, since I just recently started the 1.0 and it's only been 2 weeks. I'm kind of back to that same situation of having to use the restroom almost every time I eat. But I'm hoping after another week or so that will tail off and it'll be better, But that's just the main side effects that I've experienced was diarrhea and a little bit of stomach cramping.
Okay, and Belinda, what kind of side effects have you had since you've been taking Ozempic?
Okay, when I first got on the 0.50 dosage of Ozempic, I had some issues with a little bit of nausea, coming with some little stomach pains. And what happened with that is if I didn't eat within like the hour, it kind of got more. So along with being hypoglycemic, where, the sugars seemed like they got lower. And it didn't last more than a couple of hours, or either that same day I had been relieved of the symptoms by later on in the evening after I ate the first time that day after taking the dosage.
Yeah.
So now I don't really have any type of side effects when I take it.
Awesome. And I know it's the same thing with me. I was kind of like Linda when I first started. I had a little bit more side effects, but after taking it for a while, even when you increase your dosages, it end up decreasing. So Belinda, do you have any tips on using Ozempic or taking care of your diabetes? Anything that could possibly help the viewers that's possibly on Ozempic and also experience in diabetes?
To find yourself a good and able provider. Make sure that you're doing really good research in your insurance. Like if you have a website where you're searching for a provider, make sure that the provider you have has experience and expertise in the area of diabetes. Because when I had another provider that was helping me with diabetes, they had prescribed too much of the Soliqua. You're only supposed to go up to a certain amount of that injectable medication. And then after that, if it's not working, you're supposed to change to another medication. But what happened to me is coupled with another medication and the interaction, as well as the high dosage I was on for such a long time of that Soliqua, I ended up having a heart event. So I had a heart attack in 2019, and the medical staff and in the ER was the one who told me about the fact that I shouldn't have been on such a high dosage. So if you have a doctor, a physician, or even a specialist who is referred to you by your insurance, make sure that person has a history of taking care of patients and making sure that when you need to see a specialist, that you're seeing a specialist. If you're not seeing any change and make sure that you are actively getting copies and researching the blood work, because sometimes you may have issues with your kidneys or your pancreas, or even your white blood cells might be elevated over time, and you may have something going on in your body to where you haven't even been told about it, because a lot of doctors are like, oh, it's a little high, but that doesn't matter, or we're not worried about that right now. But if you see it consistently and it's 6 months to a year that this is going on, then you need to really look into that. And I would Google those conditions and go to specialists and everything like that to make sure that I didn't have some type of cancer or my kidneys weren't giving out and things like that. So with Ozempic, my research on Ozempic is that rats came up with tumors on their thyroid, and they also had research that you can get pancreatitis from Ozempic. And so, like, I have to be very careful. My father got pancreatitis, and so I'm just, and I have a friend that has pancreatitis, and it's all resulting from diabetic issues. So my biggest deal is to make sure that your care is ongoing, that it's related to, your care providers are knowledgeable and experts in the area of diabetes, and that your medications and your treatment are not just to treat the symptoms, but to try to help you to get rid of the disease, because diabetes is curable.
Yes.
people don't get cured from it because of the healthcare system and some of the loopholes in it, and also because of the difficulty in caring for yourself. Another thing is to make sure you have an ongoing exercise regimen. So like for me, I pay to go to the gym, and that pay takes a chunk of anything that costs money is going to be some type of motivation to help you to keep going. And since I started a second job, I've been inconsistent about doing that. So to make sure that you have some type of exercise regimen. If I can't use 10 minutes to dance in front of the television while I'm watching my favorite show, then I can get in the car and go up the street to the gym.
Exactly.
And walk around the block, you know? So that's another thing. And then the most important thing out of that is watching what I put in my body. Because I've even gone to an exercise boot camp, lost 30 pounds, but my blood sugars didn't change much because of what I was putting in my body.
Yeah.
So to making sure that we think of sugars as poison to diabetes, that's just all to it. And even though I use sugar substitutes and stuff like that, our brain doesn't know whether it's sugar or not. And it still counts a substitute for sugar as sugar. So our favorite drink we need to get to be is water.
Yeah.
So I'm worried about Diet Cokes and Coke Zeros and all this stuff, and tea and Crystal Light, because it has sweeteners in it.
Yes. Yeah, you're right.
Start substituting waters, and again, you know, the more water we drink, it's better for our kidneys and our liver anyway. And so all of the advice that the doctors give us, they don't give it to us with conviction because of what they see on a regular basis. People don't follow through.
Yeah.
So you're that person who follows through, and that's my tip.
Okay, well, thank you so much, Miss Belinda. And Linda, what do you have? Do you have any tips on using Ozempic and taking care of your diabetes?
Well, I have to say, you know, Belinda she's had it really hard with her diabetes, and I really admire how well she's fought and taken care of herself. I have been very fortunate with my diabetes. I haven't had any real complications, no real problems from it. I always say I'm like one of the most horrible diabetics because I have two brand new test kits that are, you know, never been opened in years. I don't test my sugar, and I eat what I want and I drink what I want. So I guess I say that to say I'm a horrible diabetic. All I can agree with, especially with Belinda, is, you know, making sure you're seeing your doctor on a regular basis. Go to your doctor, have your A1C check your blood sugar. Your body is a temple, and it does tell you when something is wrong. You know, it's important to get enough sleep. And the water, yes, I remember when I would never drink water and all I would drink is Pepsi. I used to kill a 12-pack of Pepsi. I do drink water now. So just, you know, getting sleep, taking care of your diabetes, having a great doctor, taking your medication, and, you know, other than that, like my only tip for diabetes, and, you know, is like if you're able to get an Ozempic and try it out, you know, hopefully it'll help you. I feel like it's helped me. It has lowered my A1C, so my A1C has gotten better, and losing the weight has been an absolute bonus, you know, to lose the weight and to, you know, and hopefully it keeps going so I can get back to the size I was, you know, 20 years ago.
I hear you on that one. That's what I'm hoping to get down a lot. Well, ladies, this is the end of our interview, and I want to thank both of you for coming on and sharing your experience with your diabetes as well as using your Ozempic. I thank you so much. We probably have to do this again to expand on this or do a check-in or something like that one day. But I just want to thank both of you, Belinda and Linda, for joining me today. And did y'all have any last words, Belinda?
Say that Linda hinted to something when it came to the sleep, because all of that is tied up in our mental health. And being a school counselor, I notice how many more people are at risk for suicide, especially young people. But I know with diabetes, some things come with it, including depression. And I struggled through all of those years with having depression. And I would go in and out of depression, and spiritually able to overcome through prayer and through a lot of focus on the positive. So a lot of times when I would get depressed, I would push my diabetes to the back burner and just do what I do. You know what I mean? To go and have a couple of drinks, have some dessert, have some this and that, what the restaurants serve and everything like that. And you just don't realize how much preservatives and unsaturated fats are going into your bloodstream. And over the years, what that does is builds up plaque. Yeah. And so educate ourselves on, yes, the weight loss is always a bonus because it's going to regulate some other functions in our body, such as blood pressure. And blood pressure is, again, known in this nation as the silent killer because a lot of people don't have any idea about blood pressure. If you got a lot of headaches, they might not be migraines. They might be as a result of you taking in too much sodium or too much stress. So my mental health, that brought my blood pressure down a lot, and learning how to deep breathe and have some meditation practices and things like that, especially the physical activity. You can get some of that stress out doing that. So I'm just so glad that you guys are working towards the self-improvement. And I think that being linked up and networking with you beautiful women and, you know, maybe struggling with the same thing, but having the same positive goal, that will be more successful. And maybe if we can be accountable to each other, like maybe take some body pictures and stuff and send them to each other, that would be great.
I hear you on that. Definitely, we can afterward we can talk more on what we can do to follow up. So I do want to thank both of you